Okay. How you feeling today?
I'm okay.
You're okay.
Yeah.
Okay, so you came in for a scheduled appointment, okay, and we talked last time that you were going to come in to get an IV. So do you know what an IV is?
No.
Okay, so IV is a long word that stands for in your veins. Intravenous means in your veins. So it's a tiny, tiny tube. It's a little straw that goes inside your veins. So what the nurse does, and she gets it right in there, and it's going to give you your medicine. So I heard you've been sick.
Yes.
Been really sick, been throwing up, headaches, not feeling good.
Yeah.
Okay, so the reason why you're getting an IV is because I think your medicine's not staying down, is it? Yeah, so we're going to give you this IV and it's get the medicine into your body really, really fast. It's really the best way. So it's going to come down a big straw. It's going to go in the little baby straw in your arm, in your hand. We're going to try to do it in your hand this time. Okay, and you're going to get your medicine.
Okay.
So you got to decorate a doll before coming into the room, okay? So do you want to give her a name?
Susie.
This is Susie. You did a very good job decorating. Susie, this is perfect. Okay, so now what did you draw on her?
Tears.
Tears, why?
Because she's scared.
She's scared. Okay. Well, you know what? For today, Susie's going to get the IV, and you're going to help me.
Okay.
Okay, so you're going to see exactly how it's going to happen, and you're going to be my helper.
Okay.
So usually we've got mom in the room, there's a doctor, there's a nurse, you can be the child life specialist. Is there anybody you'd like to be to help Susie today?
Mom.
You want to be the mom? Okay, perfect. So what mom's going to do, she's here. Mom's here to support you. Okay, so Susie, you're going to get an IV. So that means that you're going to get a little baby straw inside of your arm for your medicine. Okay, so how are you feeling?
She's a little nervous.
Yes, she is. Okay, so but don't worry, I'm going to show you everything you're going to need. Okay, so when you get an IV, this here, Mom, why don't you hold Susie?
Okay,
Good job. Okay, so this right here, okay, is where the medicine's going to come through.
Okay.
So for the purpose of today, we don't have an actual IV needle because we're just going to do play. We're going to just play with this. We're going to see what it looks like.
Okay.
This is just a syringe, but it looks exactly like the what they call a catheter. It's a baby straw, okay? So there's a little straw. It's going to go inside of this. This is the needle. It's blunt. You can touch it, okay? So let's see. Susie, do you want to touch it? You want to touch it? Okay, good. This is not very sharp. This is just to play with, okay? So inside of here, if I take the needle out, and just this little pink piece is going to be a little white straw. It's kind of like a cat's whisker, okay? Very, very flexible. It's going to be right outside of this, and the needle is just to help the straw get in, okay? So the nurse is going to just gently glide it under your skin, and the needle is going to come out, and only the catheter is going to stay in. Okay. How are you feeling now, Susie?
A little bit better.
A little better now that you saw it, maybe?
Yeah.
Okay, I'm going to stick this back on here. Okay, let's see what else we've got. Okay, so what we have to do to make sure that the nurse or the doctor can see our veins is we have to wear this special armband. Okay, this big blue band. It's called a tourniquet. Have you ever seen one before, Susie?
No.
Okay, so let's see. So this is just going to kind of go right on your arm, and it's going to help the veins show up, okay? So what arm do you color with or that you write with in school?
My right.
You're right. Okay, so would you like to get your IV on your left arm then? Just so that you can still color and play?
Yes.
Okay, so what we're going to do, and Mom, maybe you want to help. We're going to just get this right around here, and we're going to tie a knot, okay? So let's see. Okay, Susie, Mom's going to put this armband on for you. We're just going to tie a knot, and it's going to get nice and tight. So what this does is it just kind of squeezes our arm up top, and then Susie, all your veins are going to show up to make it easier for the doctor to get our IV and to get our little straw into your arm. Okay. So let's just make sure we have everything. So good. Everything's going to show up. It's going to be great. So before we can do that, we want to make sure, Susie, that your arm doesn't have any germs on it because we don't want the germs on your skin to get into your body. So we have here is a prep pad. It's just alcohol, okay, a alcohol pad. It's going to get all the germs off. So you're going to see exactly. It's going to feel kind of cold on your skin, but it's only for a couple seconds, and it's going to get rid of the germs. Ooh, and it smells really strong. Ooh, what does that smell like?
Nail polish remover.
It smells like nail polish. It does. It smells like nail polish remover, okay? And it's going to, like nail polish comes off when you use the remover, it kind of cleans it off. This is gonna clean it off for you, okay? So let's pretend, I'm gonna use a little marker. Let's pretend like this is the little vein, Susie, that we're gonna find on you, okay? That's where the nurse, the doctor is gonna put your little straw, your IV. So before we can put it in there, we wanna wipe off this area and get it clean. Do you want Mom to help you do that?
Yes.
Okay, well, we're just gonna wipe it right on her arm. It's gonna smudge the blue line a little bit, but that's okay. And we're gonna get it all clean, okay? It's gonna make it all clean for you. Good job. Very good. Mom is so supportive, huh? So again, like I showed you right here is what'll be an IV needle. This is a little different. This is just a syringe for now, okay? So what's gonna go in is only the pink portion. So I'm gonna take the cap off. There's the cap, okay. So let me just make sure this is on all the way because I don't want this to fall off. Okay, so like I said, this needle, the needle is only the very small part. There's going to be a little cap there, the little cat whisker straw that's going to be on the outside. The needle is just to get into your arm, and then the needle comes right back out and the straw stays right in, okay? So while this happens, you can choose to do something that would make you feel a little more comfortable. So I think that we brought in a book, right? You've got a book here that there's some stories if you'd like to look. There goes our needle. Okay. We have a little SpongeBob doll. If you'd like to squeeze it really hard, and you know what, sometimes that helps the doctor and the nurse see our veins sometimes, okay? You can have that. We have Play-Doh we brought into from the playroom, and you can choose to look away. You can sing a song. You can hold Mom's hand, okay? So Susie, what would you like to do while you get your IV?
The book.
You want to look at the book? So perfect, there's all these stories, okay? So you can kind of choose to do that. So perfect. While you're over here, the doctor, the nurse can choose. We'll put the IV in this arm here. Okay, so I'm going to clear out some other things. So what's also really important, kind of like we put the IV, the alcohol prep, we want to make sure that our hands are also clean. So do you know what doctors wear on their hands?
Gloves.
They do wear gloves. Okay, so do you want me to be the doctor?
Yes.
Okay, so I'm gonna put on these blue gloves because I wanna make sure that because my hands could be dirty, okay? What if I went to the bathroom and didn't wash my hands? That would not be good. That would not be good. Okay, so I've got my gloves on, okay, and I'm ready with the IV. Okay, so Susie, on a scale of 1 to 10, okay, 1 being nothing at all, and 10 being really, really bad pain, how much do you think that's gonna hurt?
8.
You think it'll be an 8? Okay, you know what, I wanted to ask you before, because after it's done, and we get it all taped down, I'm gonna ask you how it went, so I can tell other kids, okay? I'd like to hear your opinion. Okay, so, this is where you can read your book, okay, and it's gonna only take a few seconds, okay, and it's just gonna be a small poke. Now sometimes what happens is the nurse or the doctor does not always get it on the first try. They've been doing it for a very long time and they're very good, but it does not always happen on the first try, okay? But you can keep reading your book and we're gonna give it another try. But for this time, we're gonna pretend like we're really good and we're gonna get it on the first try, okay? So, I'm gonna put it in, sometimes Mom wants to help put it in, or I'll just put it in for you, okay? And you're gonna read your book. And I want you to know it's okay to be upset, it's okay to cry, it's okay to yell, it's okay to kind of wiggle a little bit, and you can have whatever response you want, okay? And that's totally fine. So, okay, you have your arm ready? Okay, we ready? You're gonna read your book.
We're gonna read. Okay. Then away they went, and Lucy and Mrs. They went all the way out into the woods.
Okay, it's in. There it is.
There it is.
So what we're gonna do, Mom, I'm gonna have you just hold this down there for a second. Okay, perfect. What we do is we use a very special bandage that's gonna keep your IV in, okay? It's gonna keep the catheter, the little cat whisker straw, little straw for your medicine, and the needle came out, okay? We'll say that this is the needle. The needle came out, all gone. And it's only the little straw in our little pink hub is what's gonna connect.
So okay.
So for now, this is our special Band-Aid, okay? The special bandage that's gonna keep it down. So what this is gonna do is it's gonna go down and we're gonna keep our little trunk out of the way. Actually, no, Mom, do you want to take the tourniquet off? Because I think we don't need it anymore.
Okay.
Let's take that off.
You did really good, sweetie.
Mom's proud of you. Way to go, what a champ.
There we go.
Okay, so we're gonna go right there, we're gonna keep that on. Keep it on real good, perfect. We'll squeeze that down. So what that's gonna connect to is an IV bag. That's where your medicine is. So right here, open it up, okay? So we're gonna take this little piece of straw, this piece of tape off. This is where your medicine is gonna go through, okay? So the top of this, look how long that is. This is gonna connect to a special bag that's gonna hold all your medicine. And it's gonna come little by little, drip by drip, it's gonna go all the way down.
It's like a
And where do you think? It is like a snake, exactly. Where do you think this is gonna go?
In that pink.
You're so right. Okay, let's see if this fits right in. Did it work? Here, this
Yes.
band will come off. You know, we can always add tape over that. You know, Mom, if you want to help me out, we can even put a little bit of tape over that special band. Did it pop out?
It's okay.
So go ahead, yeah, let's see if that'll stick all the way in.
Perfect.
Okay, why don't we add a little extra tape just to make sure that that stays. And I'm doing this with gloves on. Of course it's going to stick to me. Whoops.
You got it.
There you go, you want to put that tape, and you can
Yes.
put as much as you want. I'm going to take this off so the tape doesn't stick. Is that enough, you think?
Yes.
It is. And look, we've still got the connection. Here we go. And this is going to connect all the way up to a special bag. And it's going to go drip, 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 little by little. And you've got your medicine, okay? No more taking cough syrup or swallowing pills and having a tummy ache. It's going to go right in, and you're going to feel a lot better. So Susie, how was that for you?
She said it was good.
It was good.
Yeah.
Okay, like I said, on a scale of 1 to 10, when we first started, a 1 being, oh, that was nothing at all, and 10 being the worst pain. You said it was an 8. What do you think it's like now?
She said it did.
A 3. That's great. Good. That's what I can tell people the next time they have to get an IV, because you were very brave, Susie, and now I get to use that to tell them how it's going to be for them. Great. Let me just make sure. Good. Okay. And this is great. We got it on the first try, but like I said, sometimes it doesn't always happen on the first try. So what they may do in the hospital is they have a special board that they're going to use. We don't have one here, and I don't think you need it. It's a special board that they would tape to make sure that your arm stays straight, or in case your IV is in your hand, that it stays straight, okay? So if you need it, they may do that, and they're going to add more tape, but I don't think you need it. I think it'll be good, Susie. Okay. So Mom, how was that for you?
It was good.
It was good. That was
Yeah.
great. You were very supportive. You did a very good job.
Thank you.
Okay, so we think we're ready for our IV?
I think so.
Okay, good.